put your full name in your your account there so we can take attendance. And we'll use the chat to ask questions. And also, speaking of the chat, we will be having knowledge checks throughout the meeting today. And want to thank HealthNet for providing some gift cards so that we can provide to our lucky winners of those knowledge check questions throughout the meeting. So thank you, HealthNet, for the gift cards. And we'll go ahead and get started. We do have a full agenda this morning. So open enrollment for Medicare is right around the corner, as well as Covered California. So, we know that Covered California has their kickoff event today for the Central Valley area. So hope some of you will join that. It'll be later on this afternoon. But open enrollment for Medicare, we, something that this group has requested information about before in the past, and we brought to you some information. But as we get close to open enrollment for Medicare, we have Carolina Oler from the Kern County Aging and Adult Services to tell us a little bit more details about this event coming up. So Carolina, good morning, and transfer over the mic to you.
All right. Thank you so much, Rodrigo and Argelia. Good morning. Thank you so much for having us. And I'm going to, if you allow me, to go ahead and share my screen. I know you have the slides, but that's for the attendees. So mine is just slightly different, but if I may.
Great.
Thank you so much. All right, so we'll go ahead and get started. There is a lot of content on this presentation. So some of the slides I'm going to try to go through real quickly. Can you all see this now?
Yes, we can see it.
Perfect. Thank you so much. So welcome to today's presentation on Medicare Open Enrollment 2023. My name is Carolina Ayler, Program Specialist and HICAP Volunteer Coordinator with Kern County Aging and Adult Services. This presentation was developed by the Kern County Health Insurance Counseling and Advocacy Program, HICAP. Let's first look at what HICAP is. HICAP is part of the National State Insurance Assistance Program, also known as SHIP. So it's a big network. We're part of that network. SHIP is the most dependable source of free, unbiased, and accurate information and counseling about Medicare. In addition to providing unbiased counseling, HICAP also assists beneficiaries understand the complexities of their Medicare benefits, including prescription drug plan coverage, Medicare Advantage plan choices, Medicare supplemental policies, Medicare savings programs, and long-term care insurance. During open enrollment, HICAP provides beneficiaries with Medicare plan comparisons and education on the plans so that they can make informed decisions before they decide to enroll in a plan or change their current plan. In this presentation, we're going to give you an overview of the Medicare open enrollment period, including what is the open enrollment, or what is the open enrollment period, what are the Medicare Part D coverage options, Part D special enrollment periods, how to get help paying for Part D costs through the Extra Help program, and how to protect yourself against plan marketing violations. So Medicare annual enrollment period is also known as the open enrollment period. It runs from October 15th through December 7th each year. And during this time, Medicare beneficiaries can make certain changes to their health insurance coverage, including adding, dropping, or changing their Medicare Advantage and Part D coverage. So even when a beneficiary is happy with their current health and drug coverage, Medicare's open enrollment period is a good time to review what they have, maybe compare it with other options, and make sure that their current coverage is still going to meet their needs for the upcoming year. So let's take a look at what changes can Medicare beneficiaries make during open enrollment. So starting October 1st, Medicare beneficiaries have the opportunity to review and compare their plan choices. Then starting October 15, Medicare beneficiaries can pick the coverage that's best for them. They can make as many changes as they want during the open enrollment period, but only the last change that they make is the change that is going to be effective on January 1st. So even if they change and they say, oh, I made a mistake, and then they change again, nothing happens because no changes are going to take effect until the 1st of the next year. So during this period, beneficiaries can join or switch their Medicare prescription drug plan, also known as a PDP. They can join or switch a Medicare Advantage plan, also known as an MAPD. They can leave original Medicare if they want to, and they can enroll in a Medicare Advantage plan, or they can leave their Medicare Advantage plan and return to coverage under original Medicare Parts A and B. So this open enrollment period that ends on December 7 each year gives the beneficiaries a full 7 weeks to compare and make decisions, and ensures that they will have essential plan materials and membership cards in hand by January 1st when the plan starts. So we said, Medicare plans change every year, and whether that's a standalone prescription plan or a Medicare Advantage plan, the plan must inform the beneficiary of these changes by sending what's called the annual notice of change, along with the explanation of coverage. So this notice is sent to the beneficiaries each fall regularly by October, and the beneficiaries must review these notices for any changes in the plan's costs, the plan's benefits, coverage rules, the plan's formulary, which is the list of drugs that the plan covers. So beneficiaries must make sure that their prescriptions are still going to be covered for the next year. So this notices is basically where they go and find out if there's any change. Maybe their insulin is not covered next year. And it's a good time to say, hey, maybe I need to make changes, right? Or if all of their medications are still covered and they see nothing is changing with their plan, they don't need to make any changes, right? But these plans, they do change. We do have about 32 prescription drug plans for our county, and I've seen them change anything, something as little as maybe some of the rules, maybe the pharmacies that are preferred, to something big like deductibles and copays and things of that nature. Okay, so there are two ways before we start and get everybody confused with original Medicare prescription drug plans or the Medicare Advantage plans. We're going to go over some basics. So when people are in Medicare, they have two ways to receive their Medicare benefits. One way, or one option, it's known as the original Medicare, or also known as traditional or straight Medicare, where the beneficiary obtains their Part A hospital insurance and Part B medical insurance through any provider that contracts with Medicare. So basically, the beneficiary can choose whoever they want to go see, as long as they accept Medicare. In original Medicare, a beneficiary will need to add a prescription drug plan, also known as a Part D, as in dog. Some exceptions will be for people that do get their prescriptions through other insurances like the VA, TRICARE, an employer or retiree plan. Those people they have the option of not enrolling in a Part D because they already have that prescription drug coverage. Some beneficiaries might have to, or might have the option or the right to purchase what's called a Medigap or a Medicare supplement insurance. Those policies will help beneficiaries pay for the cost of original Medicare, and original Medicare beneficiaries have to pay 20% of their services, basically co-pays. All their out-of-pocket costs will be 20%. Some beneficiaries that will not have the right to purchase a supplemental insurance, they might be low income and they might qualify for Medi-Cal, and Medi-Cal will act as their supplement, but still Medi-Cal will not offer prescription drug coverage. So that's why in original Medicare, beneficiaries have to enroll in a prescription plan separately. The other option for beneficiaries to receive their Medicare services is through a Medicare Advantage plan. These are private health plans, and they are also known as the Part C, as in Charlie. It's like the ones that you see on the TV commercials of the Part C, the Medicare Advantage plan. This is what you see on the commercials. So they offer the beneficiaries everything in one plan. So their Part A, their Part B, and Part D benefits all in one same plan. This option will require that the beneficiaries use the providers within the plan's network, and copays for services may apply. It is also important to note that if beneficiaries join a Medicare Advantage plan, they don't need a supplemental policy like in original Medicare. They can have Medi-Cal, and Medi-Cal can serve as sometimes paying for copays for that Medicare Advantage plan, but it will not be their primary insurance. Their primary insurance will be the Medicare Advantage plan, and all the providers that they see must be within the plan. So when we look now at the prescription drug plans, they are plans that contract directly with Medicare to provide the beneficiary with Part D benefits only. The beneficiary will continue to use their red, white, and blue card for their Part A and B services. And the beneficiary will be able to use any provider they want, as long as they accept original Medicare. Beneficiaries usually on original Medicare, they don't need referrals or prior authorizations to go to hospitals or see specialists or to receive any services. And lastly, as we discussed on the previous slide, since original Medicare only covers 80% of the approved services, the beneficiary will need to think about supplementing their Medicare, whether it's through a Medigap policy that they can purchase or through the Medi-Cal program. Yeah, so again, like we said at the beginning of the presentation, even when beneficiaries are happy with their current Medicare coverage, they do need to consider other Medicare health and drug plan options in their area. For example, even if they don't plan to change their Medicare Advantage or their standalone prescription plan, they should at least check to see if there's another plan in their area that will offer better health or drug coverage at a more affordable price. But again, there's some questions that need to be considered when choosing a Part D prescription drug plan. We tell beneficiaries they need to ask themselves, first of all, does the plan cover all the medications you take? That's the most important thing. How much would you pay for the monthly premiums, deductibles, and copays at the pharmacy? And things like, does the plan have restrictions on the drugs you take, like prior authorization? That means that the beneficiary must get approval from their Part D plan before the plan will pay for the drug. There's also something like quantity limits that needs to be considered, which refers to the quantity of pills a person can get per fill, like 30 pills a month, for example. Some people take 60 a month. So some plans have restrictions on those. Also, some plans have step therapy. That means that the plan will require the beneficiary to try a cheaper version of the drug before they will cover the most expensive one. And then lastly, another important question is my pharmacy and the plan's preferred network? Some people don't know this, but beneficiaries can pay less money if they use preferred network pharmacies and not mom and pop pharmacies that are in town. Sometimes they will pay more for their medication. So with all of these things to consider, it's always recommended that the beneficiaries request a plan comparison from HICAP, because out of 30 some plans that we have, we sorted down to the 3 best that will cover their medications at the lowest cost. And then they can make a decision and say, okay, I'm going to enroll with whichever plan they want to choose. In Medicare Advantage, there is a difference, right? Because these are plans that cover all in one plan. So things to consider are not only their medications that they take. When beneficiaries enroll in a Medicare Advantage plan, they assign their benefits to the plan, meaning this will be their primary coverage for everything. So they will have to work with their primary care doctor to manage their medical care and get referrals to other in-network specialists. All specialty services must be approved by the plan medical group assigned to that beneficiary. So in other words, you see this Medicare mock-up card that we have here. It does have a medical group written on it. If the beneficiary goes to a different doctor, a different medical group that is not this one, the beneficiary might receive a bill. Okay, so sometimes that's one of the most important things. When they move from one Medicare Advantage plan to another, first thing that they need to ask is my medical group or my doctor within the plan's network. And when they do that enrollment, they need to tell the person that is doing their enrollment that this is the doctor, because he needs to show on this card, right? For them to not have issues later. Beneficiaries can certainly use out-of-network providers only for emergencies, though. The plan will not cover the services if the beneficiary goes to an out-of-network, like we said, for other things. But if it's an emergency, they will be covered. So things to consider with Medicare Advantage plans, they usually include prescription drug coverage, so that's a good thing. But beneficiaries enrolling in Medicare Advantage plans should consider asking a lot more questions, because these plans also cover hospitals and doctors. They need to consider cost. How much would you have to pay for the office visits, hospital care, or specialty services? Is there going to be a premium? How about copays, co-insurance? All that stuff needs to be asked. Medicare Advantage plans have a yearly limit on the out-of-pocket cost. So once the beneficiary reaches a certain limit, they will pay nothing for covered services for the rest of the year. So cost is a big thing to consider. Another thing to consider is doctors and hospitals of choice. Like we said in the previous slide, they need to make sure that their doctors they see are within the plan. Obviously, prescription drug is a big factor. Would your prescriptions be covered within the plan? So the insurance agent should take a list of those medications and run it through the plan to make sure that they are covered. And then there are other considerations like coverage. So Medicare Advantage plans must cover all of the services that original Medicare cover, like medical services and supplies in hospitals, doctors' offices, and other healthcare settings. Medicare Advantage plans may offer benefits that are not offered in original Medicare, and you see this on the TV commercials that the plan offers vision and dental and other benefits. However, they do have a cost, right? And sometimes it might not be a comprehensive dental and vision plan. However, these plans have the option of paying additional premium to get a better vision or dental coverage. We're going to move on to special enrollment periods. So in prescription drug plans or also the Medicare Advantage plan. So during this open enrollment period and every year, the beneficiaries should make all their changes that they want to make during the October 15 through December 7 deadline. But let's say they didn't make a change on time, they missed it, and here comes next year, and maybe they can switch, but maybe they can't. So we're going to go and see what opportunities they will have during the year to make these changes. So beneficiaries can make only one change to their coverage between January 1st and March 31st. This enrollment period is called a Medicare Advantage open enrollment period. And during this time, they can switch from one Medicare Advantage plan to another, or from a Medicare Advantage plan back into original Medicare with or without a prescription drug plan. So this enrollment period in January is only for people who are enrolled in a Medicare Advantage plan. If they are enrolled in original Medicare, they will not be able to make changes during this time. Another special enrollment period is for beneficiaries that receive the program called Extra Help. It's a federal program that helps beneficiaries pay for some or most of the cost of the prescription drug coverage. If the beneficiary is enrolled in this program, they will have a special enrollment period to enroll or switch their Part D plans once per quarter. So that will be only for the first 3 quarters of the year, January through March, April through June, and then July through September. There are other circumstances where beneficiaries can also be eligible for a special enrollment period to change their Medicare health or drug coverage. And that will be, for example, if the beneficiary loses their employer, retiree, or their union coverage, if they move out of their service area, or if they leave or enter a nursing home. Another thing that escaped me is on the middle section of this slide, other beneficiaries that are able to make changes to their coverage once every quarter for the first quarter, for the first 3 quarters of the year, is Medi-Cal recipients, because Medi-Cal recipients automatically get this Extra Help program. So it allows them to have a special enrollment period as well. So when beneficiaries don't know if they have a special enrollment period, we just recommend them to contact us because we can check to see if there is a special enrollment for them. So what happens if a prescription is not covered by the prescription plan? They're stuck in a plan, and let's say they don't have a special enrollment period through the year. So we can help them look into different things. One of them is called transition fill. Beneficiaries may be entitled to a 30-day transition fill of their drug if their medication is not a new prescription and they are in the first 90 days of being in the plan. So we can look into that. There's also something called exception request. If the beneficiary is not entitled to a transition fill, they can ask their doctor about switching them to a drug that is covered by their plan. If other drugs are not appropriate, then they can file an exception request. The doctor must explain the medical need for the requested drug and explain why other drugs are not appropriate. There's a standard review that takes 72 hours, and then there is an expedite review, takes 24 hours, and that is for people that have serious health conditions. If that exception request is denied, they have the right to appeal, and HICAP can assist with that process of appealing. Then lastly, if everything fails, we look at patient assistance programs. Patient assistance programs are programs designed by the manufacturers of the drugs directly. They have an income limit, but normally it's high income limits. We see sometimes it's like 500 federal poverty level. So most times people tend to qualify for those programs. They can help beneficiaries pay in full for the drug. And they will have to reapply every year to get that assistance. So there are things that can be done. We're almost getting to the end. This is the Extra Help program we talked about. The beneficiaries can apply for this program through HICAP. We can assist them doing the application and submitting it. Some people that have Medi-Cal, they don't have to apply. They immediately will get the subsidy. So depending on the beneficiary's income and resources, they can qualify for the full Extra Help or for partial Extra Help. If they have the lowest income and resources, they will pay no premiums or deductibles, and they will have small or no co-payments at all. If they have a slightly higher income and resources, they will have a reduced deductible and pay a little more for out of pocket. If people qualify for extra help, they won't have a coverage gap, which is a period in every prescription drug plan has this coverage levels. The coverage gap used to be called the donut hole. The donut hole has been getting smaller and smaller. Right now, people pay 25% of copay during that period, but people that are on extra help, they don't pay for that gap coverage. Also, if beneficiaries enrolled late into a Part D plan and they have penalties, extra help will help them avoid those penalties. Also, beneficiaries with retiree benefits and low incomes, they might qualify for extra help, but they need to check with their current coverage or employer or retiree plan, because sometimes they have restrictions that if they enroll in a prescription plan, they will lose the retiree
I don't
benefit.
know if I signed up.
So I'm sorry, it is important to check with their current plan. And I believe this is our last slide, and we're going to talk about Medicare fraud. So there are lots of restrictions for Medicare plans. Medicare plans must follow these rules when they market plans. They cannot pressure beneficiaries to join their plan by saying things like, you have to join this plan or you won't have coverage next year. They can't tell the beneficiaries that they represent Medicare or that they want to offer them a service for free. In exchange, they ask for their Medicare number. They cannot call or visit the beneficiary's house without their consent or permission to offer plan enrollments or services or free medical equipment. They are not allowed to offer beneficiaries cash or groceries to join the health plan, and they cannot sign an enrollment plan form for them. So we always tell the beneficiaries that if they've been misled into joining a plan, please call our office. They can also call the California Senior Medicare Patrol and report it. We always remember or try to tell our beneficiaries to remember that if they are satisfied with their plan, they don't need to change anything. And we remind them to never give their Medicare number to a stranger or anything they do not trust. So this concludes our presentation. Please feel free to send your questions to the email on the screen. Or if you have any questions right now, I'll take some if we have time. Also, I'm going to share with you all our open enrollment flyer, which will have all the services that are offered by HICAP during this time. So feel free to share with your community. We also will be offering a webinar for Medicare beneficiaries and their caregivers, families. Everybody's welcome to join that webinar. It will be free for everyone on September 30th at 10 a.m. And finally, I will share a link on the chat with our survey. This survey will help us bring more and better presentations in the future. And if you like, you can also scan the QR code on the screen with your phone and take the survey from there.
Carolina, just one quick question here. What would be considered an emergency so that Medicare can cover an out-of-network visit?
Yeah, so if, beneficiary has a stroke, they're not feeling well, they have to go to the emergency room, or they have to go to urgent care and they're not in their service area. For example, if you went to LA and, you weren't feeling good and you had to go to the emergency.
Great. And it says, will you be providing your PowerPoint info? Is it okay if we distribute?
Yeah, so Argelia has a copy of my presentation slides, so she can share them. And right now what I can do is I can put in the chat also the survey, so I can stop sharing and just put the survey also on that chat and the flyer for our upcoming webinars.
Great, thank you. I don't see any other questions. We'll go to our first knowledge check. And there are some rules here. We're we're going to be using the chat box to enter your answers. First correct answer wins. And presenters are not eligible to participate in the knowledge check. So Carolina, sorry. All right. Partial answers will not be accepted. So the first full, complete, correct answer is the one that gets a gift card. And our first gift card is a $10 Walmart gift card. Thank you, HealthNet, for providing those to us. When is Medicare open enrollment period? It's the chat box. Monica Fitzgerald, winner. October 15th through December 7th. Great. All right. Well, we'll continue on with our meeting. Thank you, HealthNet, for those gift cards. At the end of those of you that don't have access to a chat box, if you're calling in, at the end, we will have a raffle for a couple of movie tickets that we're providing to those that are present. And unfortunately, presenters are not eligible for that either. So, so stick around till the end for that final raffle. All right. We'll continue on with our meeting, our presentation today on legislative updates. So we have Bryant Miramontes from Health Access here to give us an update. What's going on legislatively, Bryant?
Yeah. Hi, everyone. Thanks for having me. Can folks see my screen?
Yes.
Great. So thanks for the introduction, Rodrigo. So my name is Bryant Miramontes. Pronouns he, him. I'm a senior campaign organizer with Health Access California. Health Access is the lead healthcare consumer advocacy coalition in California for over 30 years. I believe it'll be 35 years this year. Health Access has led on the consumer advocacy piece, advocating for quality, affordable, equitable healthcare for all Californians. What we do with our work and through legislation is preserve access to care, protect consumers, and ensure really significant comprehensive health reforms. And what I'm going to do today is discuss some of the work being done kind of within this context and some updates at the state and federal level, which is actually a bit complementary to what you just heard on the Medicare piece, given the federal legislation that was just passed. So first, I'll actually start with that. So the Inflation Reduction Act was signed in, I believe it was back in August. And what the bill does is it lowers prescription drug costs, lowers healthcare costs, and lowers energy costs, really making everyday necessities more affordable for Americans. And I'm going to focus on the healthcare provisions briefly within that, specifically the prescription drug piece and then the healthcare/health coverage pieces. So just high level on the prescription drug front, what the bill does to lower prescription drug costs is empowers Medicare to negotiate drug prices, which is incredibly significant, giving Medicare the power to start negotiating drug prices. I believe it's going to be 10 drugs starting in 2026, I believe, and then it'll increase from 10 to 15 to 20 drugs and further as the years progress. This is something that other countries do, and this is something that is a huge step to get us to actually have more affordable prescription drugs, at least for folks on Medicare over the age of 65. What it also does is caps Medicare beneficiaries out-of-pocket costs at $2,000 per year. So this is definitely a huge impact for hundreds of thousands of folks who are, especially in California, who are spending more than that on their prescription drugs alone if they have underlying health conditions. There are a lot of folks living with specific conditions who do pay either over thousands of dollars for their drugs and medications per year, but there are also a lot of folks who, because these costs are so high, they actually don't get the drugs at all. and they avoid even getting the necessary drugs that their doctor recommends. So this is a huge deal. It has a direct impact on the folks who are already paying that much, or over $2,000 per year on prescription drugs, but it also has a protective impact on the 5.1, I believe, million folks in California who are enrolled in Medicare Part D, just ensuring that they're protected from having to potentially in the future, if they do have to rely on medication that could be more expensive, it's protecting them from spending more than $2,000 per year, which is incredibly significant. It's literally impacting somebody's livelihood and whether or not they would even be able to survive from affording some of this medication. Also, what the bill would do is it's going to do is penalize drug companies for price hikes that exceed inflation, which is a huge deal as well. So that over time, we're actually able to get folks to afford it and support this affordability while also reducing those costs on the front end. Also, what the bill does is cover vaccines completely for seniors under Medicare, which is hundreds and hundreds of thousands of folks who have vaccines under Medicare in California. Another big deal. And then the last one, which is a huge win, is it does cap Medicare beneficiaries out-of-pocket costs for insulin at $35 per month, where it could be up in the hundreds per month. Now, because it's now capped at $35 per month, folks now can actually, especially folks who are on set limited incomes, are able to spend this money on groceries and other necessities that they don't need to necessarily spend on their insulin costs. So a huge win, especially for seniors on Medicare. There is a lot of work being done to expand some of these to all folks on private health insurance as well. And that's still a big fight that is continuing, but this is definitely something to celebrate. And this impacts millions and millions of seniors throughout the country. If you'd like any more information about the California impacts on this, I do have some data as well. Please reach out to me. I'd be happy to share that with you. The next piece is something we've also been working on for quite a bit is the Inflation Reduction Act also continues the premium tax credits under the American Rescue Plan for ACA individual marketplaces. And as folks are familiar, our marketplaces covered California. What the American Rescue Plan Act did in 2021 was it capped premiums at 8.5% of income by providing federal subsidies to states. Really ensuring that folks don't have to pay more than about 8% of their income, and actually even less for folks with lower incomes. Just for context, previously folks were paying like 16% of their income, which is incredibly high, as thousands of dollars per year on premiums. And this really helps cap those premiums at a more affordable rate. And it also extends those subsidies for 3 more years. So with this bill, folks will continue receiving this federal support, making health coverage more affordable, definitely impacting over 1 million folks who have covered California. And it extends the subsidies until the end of 2025, where the bill will sunset. And then starting in 2026, if there is no action done on this in Congress, unfortunately, those will expire and premiums will skyrocket. But it is something to celebrate, at least for now, that folks are going to have that continued coverage. That would be a total of 5 years that folks are receiving this needed and welcome support, actually, just given how, as we all know, folks are dealing with inflation and high costs on all fronts. So that's just a little snapshot of the work at the federal level. There, I do have a bit of data as well on the California impact, especially how this bill impacts the different counties and how many folks are enrolled, how much on average folks are paying. So if you'd like any data on that within the counties that you are working in, please let me know. I'd be happy to share that with you. It's split up. We have it split up by covered California region among, I believe it's like 9 regions that covered California has. I believe it might be more. Also by county and also by congressional district. So I'll just speak now about our state work, because a lot of our state work is actually, it's intertwined with what's happening federally, which I'm sure a lot of folks here can understand. We have a coalition that we work on chairing. It's the Care for All California Coalition. And the goal of the Care for All California Coalition is to advance urgent state policies to achieve high quality, universal, equitable, and affordable health coverage for all Californians. We have over 70 organizations throughout the state on this coalition. Really the goal, just in a couple of words, is to get us to universal health care. And to ensure that that system is a system for all and that folks can actually access that care. So as you can see, there's quite a few folks who are on organizations and groups who engage on this campaign, representing a variety of different constituencies. We have reproductive justice, reproductive rights, consumer groups, labor, immigrants justice, immigrants rights groups as well, among others. And we've definitely come together to really just make sure that our healthcare system is a healthcare system for all. And we do that through a variety of priority areas, one being covering all Californians, improving affordability towards universal coverage. So we call that our access section. So we work on legislation to improve access, coverage, and affordability. We also work on legislation to improve healthcare equity and quality within the context of a universal healthcare system, while reducing health disparities, for example, or addressing them through legislation with the intended outcome of reducing the health disparities and improving quality and ensuring transparency as well is a pretty significant issue. And then the last component here is reducing healthcare costs on the front end and ensuring industry accountability as well, just to make sure that the healthcare providers that we depend on and the health plans that we give so much trust to really act in the best interest of the consumers that they are supposed to serve, especially when they are primarily focused on their bottom line. So some of our policy priorities for the year, I do want to just provide a snapshot of some of the successes that we've had this year, specifically through the budget. So through the budget, some of the priorities that we've advanced as a coalition include those included here. One being removing immigration status-based exclusions in Medi-Cal for ages 26 through 49. That's over 1 million folks who, starting in 2024, will have access to full scope Medi-Cal coverage. Of course, for those who are income eligible. So given this expansion, which I'm sure a lot of folks again are familiar with, this ensures that by 2024, everybody, regardless of documentation status, who is income eligible will have access to full scope Medi-Cal coverage. So this is a huge win. It's millions of folks throughout the state who now will be able to seek care for really treatable and preventable health conditions, among many others. So this is a big deal for access. It's a big deal for equity. And really, it's a big step that gets us towards universal coverage, given that the largest group of folks in the state who are uninsured are those who are undocumented. So it's really just ensuring that we're getting, not just ensuring, it's also ensuring that we're getting to an even stronger healthcare system for all. Since, as we've seen with COVID, our health is incredibly intertwined, and it's incredibly important that this, and meaningful, and it's significant that this was able to get done this year. Another component is establishing an Office of Healthcare Affordability with the goal of setting cost targets across the entire healthcare industry to lower the cost of healthcare over time relative to inflation rates and relative to wage growth. And with this office, it's really just containing healthcare costs by ensuring that healthcare providers are held accountable for charging insanely high costs for care, especially having those costs increase from one year to another, especially having those costs arbitrarily increase from one year to another, and ensuring specific metrics and enforcement mechanisms to make sure that everybody here can start to actually afford care, and healthcare won't ideally necessarily mean needing care wouldn't necessarily mean potentially having to deal with financial ruin. And this is a big deal. It was signed into the budget as well. And we're looking forward to implementation of that. Another component is eliminating premiums and copays in Medi-Cal for over 535,000 families, specifically young children as well. And although we did hear a lot of providers did not actually enforce these or charge these, this is something that is still a deterrent or a barrier to care. So it's definitely something we were excited to see in the budget. And lastly, another issue that was included was eliminating Medi-Cal share of cost, which is about, I believe, $600 for low-income seniors and people with disabilities. It will start to be phased out, but it'll eventually be completely eliminated. Again, ensuring that folks can actually access the care without that $600, which can mean the difference between having a roof over your head and not. A lot of success in this budget this year through the campaign. A lot of our partners really spearheaded a lot of these issues. So definitely celebrating that. If you have any questions about these, please let me know. Be happy to either connect you with the right person who can elaborate on this, or I can speak to some of these, given that these were our priorities. I do see a question here. So the question is, for the exclusions for immigration status base, what information is required on behalf of the individual to receive Medi-Cal? I will follow up with you, but it's all on, I believe it's on the DHCS website, where you can see the application, and that information should all be there as far as like name, address, and other issues. But I can follow up with you if that is something that is hard to access. So moving on, for some of the bills for the campaign that we've been prioritizing. So all these bills have passed the legislature and are now enrolled. And so pretty much that meaning that the governor is considering whether or not he will sign or veto these bills, but definitely incredibly important that these actually had passed the legislature, and it's significant in that way. We want to, I just want to highlight some of the issues that are kind of what we're focusing on and really putting a lot of work around to ensure that they get signed. One being AB 2530, which is a bill that would keep striking workers covered, which pretty much would ensure that striking workers don't have health coverage hanging over their head or used against them by their employers if and when they do go on strike. What it would do, if signed, is ensure that they have access to the most affordable Covered California plan. I believe it's a Covered California Silver plan, so we're hoping that that gets signed. Also, SB 923, which is Senator Wiener's bill, would improve access to gender affirming care, ensuring that folks who are TGI are receiving adequate care through, I believe what the bill would do is ensure that the health plans require the providers within those plans to have specific trainings and around dealing and handling and handling the patients of all backgrounds of sexual orientation and gender identity backgrounds to ensure more quality and equitable access to care. So that's a bill we're hoping to get signed. And also, you can see a couple of other bills here. Another bill I'll just highlight is SB 858, which is one of our priority bills. The bill would ensure more accountability for health plans by imposing a 25, so it would pretty much increase the fines for health plans who incorrectly, I guess, deny access to specific care for consumers who are waiting for care, and who actually pretty much, if they deny services, if a health plan denies services to a consumer who's enrolled in their plan, and the health plan is found to be in the wrong or incorrect for denying that services for the enrollee, that health plan is right now only being fined $2,500 for that, which is a drop in the bucket for these multi-billion-dollar for-profit health plans. What it would do is update that amount to $25,000 for each infraction to ensure that we have a more ensure that folks actually receive the care that they need and in a timely manner, given that this does happen quite a bit where folks are denied care and they do not, and the plan doesn't have much of an accountability for it. Given $2,500, it doesn't mean that much for them. So we're hoping that that gets signed soon. And all the other issues here. The last couple of ones I'll just flag is SB 967, which is an issue. It's a issue related to coverage access. The bill will connect taxpayers to healthcare coverage information based on their income. So what it does is on tax forms, there will be a checkbox added, and folks will have an option to learn more about their health coverage options, which is just a really great way to help streamline the enrollment for specific plans and reduce our uninsured rate. It was signed recently, so we're excited to see that, and excited to see how that is implemented. And who knows, when you do your tax form, you might start seeing that. So if you have any questions, please let me know. The last thing I'll add here, and this is, I promise, is the last one, SB 944, which is Senator Pan's bill. The goal was to make Covered California more affordable with this continued support from the federal government for premiums. What the bill would have done is really address cost sharing. As folks, I mean, as we've seen, a big deterrent to accessing care and going to needed visits, for example, is the cost of actually visiting. So we're seeing doctor's visits can be about $50 to $60, depending on if it's a primary care or your specialist, which is definitely a big deal for folks with lower incomes. And also we're seeing deductibles be on average about $4,000 for silver plans, which for folks who are seeking necessary care can mean completely using all their savings or putting them into debt. So what the bill would have done was ensure that Covered California leveraged funds that were already committed by the legislature to support with cost sharing by eliminating deductibles and reducing copays for hundreds and hundreds of thousands of Covered California enrollees, specifically folks with silver plans, with the goal of ensuring that once folks either pay their premiums or receive coverage, that they feel confident enough to actually use that coverage, given that the cost of care is still a deterrent to access. Unfortunately, the bill was vetoed by the governor within the last couple of week or so. I believe it was a week ago. And we're aiming to, this is a big setback. We're aiming to continue getting this support for folks as they need it, given just the strain that we're under with COVID and still with inflation. And we see this as something that's incredibly needed by the stories that we're hearing. So we're going to continue working on this, and the fight is definitely not over on this. But if you have any questions about that or the details, please let me know. Thank you for the question, Amelia. Amelia asked, what was the rationale for the veto? The rationale for the veto in the language was that given that the Inflation Reduction Act only extended the subsidies for state subsidies for 3 years, California, they wanted to reserve and preserve the state funds to supplement the state subsidies if those federal subsidies were no longer continued after 2025. And that is an argument, and it's something that we don't necessarily agree with. So as folks know, the individual mandate is something that's required at the state level for folks who do not have health coverage. They have to pay a tax from the California to California. That funding is supposed to go to affordability assistance. And right now it's going nowhere. Actually, since 2021, it hasn't been going anywhere. It's just been going to what they're calling a affordability reserve, which we have yet to see. But the legislature committed over $300 million to support cost sharing this year, and that is going to a affordability reserve now. It's something the legislature has pushed back on immensely before the governor vetoed. But unfortunately, we know that the thing is, folks are already paying the individual mandate. The money is there. If we can give the folks the support they need now, we need to do it. And if we have the funding to do it, we should. And the rationale is kind of flawed because the money is already there. And if the money from the individual mandate is not going to support the affordability piece, why are we collecting this from consumers? Like, what is the actual point? And why are folks having to pay hundreds, literally almost, I think it's like $600 per year on average for their individual mandate fees. So with that said, if you'd like to learn more, I'd be happy to chat offline. Sorry for going on that rant. But here are some opportunities to engage. If you're interested in helping and joining the coalition, or if you have any questions about the coalition, please let me know. One thing I'll just flag is for personal stories. That's always a big help, especially if you have folks who are dealing with high deductibles who need support, among the other issues I've kind of touched on. I will be happy to share my email in the chat. But thank you all. Hope you all have a great rest of your day. And again, appreciate you all for letting me sit and talk for the past 20 something minutes.
Thank you, Bryant. Great information as always. I think especially this presentation really brought some, a lot of things that have been going on. And I know we missed you at a couple of meetings prior. So thank you for that update. It's really very informative. So if you have any questions that you would like for us to pass along to Bryant, go ahead and send those to us. I know kind of running a little bit late this morning, but we'll definitely get those questions to Bryant, and we can share those as well with the rest of the group if Bryant sends us responses as well. So thank you. We are going to have our second knowledge check, and one thing I did forget to mention last time is previous winners. So sorry, Monica, you won't be eligible for to answer further questions. So we'll let somebody else win. But this next question has an Amazon $10 gift card as a prize. So what will occur by January 2024 that will support access to healthcare for all? If you remember Brian's presentation here. What will occur by January 2024? First correct answer in the chat. It's a $10 Amazon gift card.
Looks like Maria Castro.
Yeah, that one is very correct. The previous one, is it Gabriela? Yeah, it's sort of correct, yes. but Maria Castro gets our $10 Amazon gift card, and thank you, HealthNet, again, for providing those gift cards to us. And we'll continue on with our meeting. I know we're running a little bit late, but very important information from Department of Human Services regarding Medi-Cal. And we have Kayla Hughes, and just want to say thank you to Kayla. We're so grateful that you're one of our partners, and that you do so much behind the scenes that not a lot of people get to see that, but you are a tremendous resource for us.
Well, thank you.
So thank you for joining us.
Thank you for that. No problem. My pleasure. All righty. My name is Gayla Hughes, and I'm an assistant program director here for the Department of Human Services. And Rodrigo reached out to me about presenting today. So I always reach out and I say, we have a ton of information and what's most important to you guys for me to share. So they sent over some questions and I did some research and I'm going to provide the answers to their questions and hopefully get some new information out there. So thank you for having me. So some of the questions they were wanting information on was with Benefits Cal, which is our portal that you can go on and complete applications. Clients can use it, CBOs can use it. And when will there be a next update that occurs to the benefit portal? Currently, there's no specific date. There's constant updates that are coming in the future. And so Martha Esparza, who is another assistant program director here who works directly with Benefits Cal, she is going to provide to me each update as it occurs, and then I will share it out with Rodrigo and the group, and then they can forward that information to you guys. So you guys are always aware of the changes as they occur. All right, next slide. All righty, so will the Benefits Cal portal add Medi-Cal case numbers, eligibility worker information, client SIN numbers, and any pending verification or documents needed to be completed on the application? And the answer is yes. The portal does provide CBOs with detailed information about the applications they submitted, such as the application number, customer's first and last name, the date of their birth, application status, application date, case number, and if it was assigned to an eligibility worker, along with an action item list. So you can always go in there and see what actions have been provided, who provided them, and what is still needed to be submitted. And it will not provide any details regarding to if the application was denied. But there is going to be an update that's going to come in 2024 that will allow you to go in and view Benefits Cal denials and see why was that application denied and if you still have time to provide in order for us to process it. So that is coming in the future. All right, next slide. All right. Also, there's going to be Cal SAWS will be hosting a Benefits Cal CBO awareness training on September 22nd from 9 to 11 via a Zoom meeting. I shared the link yesterday with Rodrigo and Nancy, and they're going to provide that Zoom link after the meeting. So any of you that would like to go on and attend that meeting and get the information, you guys are more than welcome to attend that meeting. Alrighty, case management. Is there currently a specific worker or team at DHS that is assigned to help CBOs with case management support? Currently, we don't have a specific team assigned nor a worker. Basically, what happens is whenever your applications are submitted on the client's behalf, usually CBOs acts as the authorized rep, and they're acting on behalf of the client. So depending on what type of programs are associated with the case that we grant, determines if they go to an actual eligibility worker or if they're assigned to the call center and our processing services here at Kinship. So if they're assigned to us, they kind of go into what we have as a banked caseload. So we have you call into our call center, and I provided the number. It's 1-877-410-8812, and you'll be assisted by a CAT agent, and they will assist you with whatever your needs are. And if you're assigned to a case worker, you can call the actual worker and they can assist and the clients, and you should also get a new worker letter when the case is granted that lets you know which number you can use to make contact with the department. All righty, next slide. And also something that I do it for Dignity Health and Advantist Health, is I complete weekly reports that we assign back and forth. And so I can give updated information on any pending applications, renewals, if deemed newborns have been added to the cases, and the status of our inter-county transfers between our counties on case actions. And I also work these reports and I forward applications to application services on behalf for processing. I send requests to our meds unit to update eligibility on the state system. I will process any retro Medi-Cal applications requests that haven't been done yet. And I also order and send out bit cards on behalf of the requests to our clients. All righty, Rodrigo. All right. appointment interviews are scheduled out over the phone, are being scheduled out so far. Is this normal? And what can assisters tell their clients in regards to this? Well, yes, they are being pushed out so far, but we've had the unemployment extensions and the additional benefits that were provided because of the public health emergency. And there has been a huge influx in applications that usually aren't normal. We also went to a new system, which is CalSAWS for processing our cases, which we all had to, learn the new system, and things changed. So the way we were processing got a little delayed. And then the county currently has over a 20% vacancy rate that we're trying to fill. So all of these have kind of caused our applications to fall behind and get backed up. However, we're currently putting forth efforts to get these applications screened and appointments scheduled. So because we're scheduling so many appointments so fast, it's at a faster rate than what our calendar has opened appointments. And so that's why the appointments are out further than usual. But just go ahead and let the clients know that their appointments will be taken care of, and we will be honoring the original date when the application was received. So if they turn the application in July, but their appointment's not till October 1st, they will receive coverage or benefits back to the July date. They won't lose any time on that application. All righty. And does DHS provide training to CBOs in regards to Medi-Cal and health insurance assistance? Currently, we do not provide any training, and you can sign up to be notified for any all county letters or state letters that are posted to the DHCS website. And I provided the link right there. So you can just go in and put information. And so as they send that information to the counties, you will also receive the new updated information as well. We just don't provide the specific training on it. And what is DHCS Medi-Cal provider system, also known as MEDS, and who has access to it? So MEDS supports a number of health and welfare programs, providing automated eligibility information containing to beneficiaries currently and historic information for programs such as Medi-Cal, CalFresh, homeless assistant payment programs, and issuance of immediate need beneficiary identification cards, which is our BICs. And MEDS users are limited to designated county staff or state staff for the administration of a number of health and welfare programs, but Medi-Cal takes precedence over it. So providers can go in there and put in the SIN number and look at what the coverage is that the client has. We can go in there and see what the system is showing. So if we need to have eligibility updated, we can send a request to the state and they will add eligibility to the case. We're also able to view if the client's receiving unemployment benefits, Social Security benefits, if they're receiving SSI, SSP, any disability-based income, or if they have other health insurance, we're able to go in there and view that. If the clients are currently receiving aid in other counties, we can see which counties are receiving benefits in, so we know who we need to reach out to before we grant our cases. So this system allows us to see lots of different things that's happening with our clients when they come in to apply or as we move forward with their cases. Homeless and mentally ill individuals. For homeless individuals, what can assessors do to better assist this population with their health insurance applications? Basically, just like with any other population, the more information you can provide us, the better. So we need at least the full name and date of birth in order to process and put in an application to pend it. But if you have a Social Security number, if you can verify their income, even if it's zero, provide us their tax household information, a list of any known property, or submit any documentations that they may have. Because the more information you can provide, and if it's over Benefits Cal, we can use Benefits Cal as a completed single streamlined application and process that application right away instead of having to pen the client. So the more information that you can provide, the better. And how can assisters continue an application with few or no supporting documentations? So like I said, we need at least the name and date of birth to pin the app. But I noticed that a lot of applications, because we're doing a lot of linking of e-apps to get everybody caught up on applications, I noticed that a lot of the applications coming over that's being completed by our CBOs, all we have is a name and a date of birth. And sometimes when we go in there and we look for that client, the date of birth isn't correct or the name's not correct, so we're not able to find them, and then we don't have an address. So if we can't find them and we don't have an address, it's kind of hard to know where to send them the information, because a lot of times they don't know to come into the office to pick up returned mail. So it's just hard getting those applications completed. So once again, the more information you can provide us, the better. And can assisters continue using the DHS address for home address for our homeless clients? The answer is yes. We can always put our office address as their physical address. But if you can somehow see if they have a mailing address, that helps, because we have a place to send their mail in order for them to receive it to get these applications processed. Because if we just use our physical address, and a lot of them don't know to come in and get their applications or their mail and know what it is that they need to complete, we're denying a lot of these applications. So yeah, more information you can get us, the better. Alrighty, Medi-Cal expansion. Will young adults who reach the age of 26 be disenrolled from coverage, or will they remain covered until January of 2024? Currently, they will remain in their full scope Medi-Cal status when they turn 26, because due to the public health emergency, we can't take any negative action to put you in an aid code that's lesser than what you're currently receiving. So we will continue to allow them to receive full scope coverage until the public health emergency ends. And at that point, we will reevaluate them to see if, we put them back down into restricted Medi-Cal. But if the PHE continues through January of 2024, then it's possible for them to remain covered in full scope Medi-Cal until then. Clients who are pregnant and between the ages of 26 to 49 and have restricted Medi-Cal, must they choose a health plan? So if they are not receiving full scope Medi-Cal, then they do not need to select a health plan. Only individuals who receive full scope coverage need to be enrolled into a health plan. So it's kind of a rule of thumb. Full scope, they need to be enrolled. Restricted, we don't enroll them into a plan. Alrighty, at our prior meeting, we were informed that a batch of individuals 50 years and older did not transition to full scope Medi-Cal. And have these individuals been transitioned to full scope Medi-Cal as of now? Well, the county had received a batch of fallout reports that listed individuals who, for some reason or another, did not transition over. So our office at this time has processed all of our fallout reports. So our goal is that as of now, people have fully been transitioned over. But, just like anything else, there's those that are going to fall off, or those that didn't, get ran through the system or whatever it may be. So as we're working our cases, or if they're calling into the system, or if we're just working a report and we notice for some reason or another that these individuals have not been moved into a full scope aid code, we are taking action on those cases now. So eventually they will all be moved over. Alrighty, that's all I have for today as far as answering the questions that were sent to me. Does anybody else have any questions for me?
Yes, we have a question here.
Okay.
It's, what can we do if someone has received a notice of action and they will be discontinued as they have turned 26 years old?
Have them reach out to the office, because sometimes the system will automatically generate notices of action, because the system will just see that, there's an individual turning 26, so therefore they need to go back to restricted Medi-Cal. So if they do get that notice of action, have them reach out to our office, but also you can also ensure that the notice of action is something that's auto-generated through the system, but the action will not be taken until the end of the PHE. It's just like our Medi-Cal renewals. They'll get notices saying that your renewals due and your case is going to be discontinued if you don't complete your renewal, but the system is automatically pushing those dates forward. So we're not taking action on those, but a lot of those notices of action are auto-generated with the system. So they can always call the number on the notice just to get ensured that it's not going to happen. But yeah, they're just, some of those notices are going to go out automatically.
And Gayla, we do have a couple more questions, but I think we're running a little short on time here. We're going to send those questions over in an email, and if you could respond with the answers to those, and then we can distribute those to our network here. So,
Alrighty, no problem.
well,
Thank you,
great.
guys.
Thank you, Gayla. All right, then do we have a knowledge check question for the group? Ahelia? And remember, you must provide the answers in the Zoom chat box, must enter the full answer in the comment. Partial answers are not accepted, and the first correct answer will win an e-gift card. The next question is, there's a specific worker or team at DHS that is assigned to help CBOs with case management support. True or false? Gabriella, false. You are correct. So you get a Target $10 gift card. Again, thank you to HealthNet for providing those gift cards to us. For those that are not don't have access to chat, we will have a final raffle at the end of the presentation or at the end of the meeting for everybody to participate, except for presenters. Yes, and we'll continue. All right, Covered California updates. Marisol here from our office from CHI. Give us an update.
Hi, good morning, everyone. This is Marisol Guillen, Program Coordinator for CHI. I'll go over my slides fairly quickly. We do want to have enough time for the presenters. So just like Brian mentioned in regards to the Inflation Reduction Act, that brought a lot of help for those that are in Covered California, capping the health insurance premiums, also a great benefit for those individuals under 150% of the federal poverty level, and then more financial assistance for everyone. Here is a chart of kind of like the monthly savings in regards to the premiums, an average of $56 per month. So that's an extra savings for individuals. We do know that every year they evaluate the plans and see if they're going to increase or decrease. California estimates that there's going to be a 6.0% average rate change. However, if individuals do shop and switch into different health plans, they can see a savings up to 5.8%. Those percentages are at the California level. Here for Kern County, we do have our own region, Region 14, and the average change will be 2.7%. And those that switch or shop and switch into a different health plan, they can see a savings of 2.3%. Special enrollment period, just as a reminder, individuals can still enroll in health coverage right now if they have one of the regular qualifying life events, such as getting married, getting divorced, adding a new family member, losing a family member, or losing their coverage as well. Besides those, there are other qualifying life events, and they're the following. You or a family member have been affected by the COVID-19 pandemic. You have a household income under 150% of the federal poverty level, or you pay the penalty because you did not have health insurance last year. So those are in addition to the regular qualifying life events. As you know, and as Rodrigo mentioned earlier today, the regional meetings for Covered California are happening today. So we don't have exact dates. The only thing that we do know for sure is that open enrollment starts November 1st and it will end January 31st. We also know that Covered California current consumers should be receiving renewal notices sometime in October. More information will be given to us at the regional meetings. As always, they'll have the automatically renew consumers but also those that are going to turn into passive renewals. So our program, this timeline might be familiar for some of you. And this is something that we put together to kind of remind us of key dates for Cover California. So once we get that information, we'll make sure to send that to you. Last year, they did extend the enrollment to December 31st so that coverage could be effective January 1st. Past years, it used to be December 15th, so we will see what Cover California says this time around. The regional workshop where they'll be talking more about general state updates, but also focusing more on the Central Coast and Central Valley is happening today from 1:30 to 3:30. I will drop in the registration link. That way you can register if you need to. And these are some of the things that they're going to be talking about: policy and legislative updates, keeping California healthy, going over the regional rates and the plans, and also any call here's updates. Just a few best practices and reminders. Remember to inform your current and past consumers about Cover California's changes, letting them know that there's more financial assistance. Also, that if they shop and compare, they can see savings for their upcoming year. Also, to make sure that Cover California has authorization to verify electronically their income, because if they don't do that, they may lose all the financial assistance that they're receiving. Also, keep in mind the employer health insurance versus Cover California. If someone gets offered employer-sponsored insurance, when can they apply for Cover California? Because not everyone is able to receive premiums under Cover California unless they give us a new update in regards to the family glitch. Attend a regional workshop if you're able to. If not, I know Cover California usually sends more information via email after those regional meetings have happened. Also, complete your Cover California recertification, especially if you are an enroller. They want you to complete it before you start helping individuals for the new year. Yesterday, we did receive information about the recertification being open. You do need to pass with an 80% or higher, and then you have 3 times to take the test. And that's it for me. Do you have any questions?
I don't see any questions, Marisol, for you. So I think we have a knowledge check coming up. Right, Stephanie? Or not? Do we go into the next? Okay, all right. We'll save the knowledge check for a little bit later on. Cover California health plan update. So we invited our health plans representatives that provide services through Cover California plans to talk about some of the offerings that they're providing to their membership. So first up, we have Shield, Amelia, to give us a little bit information on what what makes them special. What's going on? What's new with Blue Shield?
Yeah, did you give me sharing rights already?
Yes.
Okay, great. Okay. Well, I just wanted to say good morning, buenos dias. Thank you so much for having Blue Shield today so that we can have a conversation about how is it that we can continue to, offer high quality coverage to all Californians at a sustainably affordable price. And this can't happen if it's not working in partnership with every one of you. So good morning again. My name is Amelia Herrera Robles. I'm one of the community outreach managers for Blue Shield of California, particularly for our individual and family plans. And so what we'll talk about quickly is who Blue Shield of California is and a little bit about our mission. We'll go over some coverage options, our choices, and our rates. Some of the added benefits are standalone dental, vision, and life coverage options, a quick overview of our resources and community support, and then if time allows, we can do Q&A, or if not, you can definitely send me an email. So who is Blue Shield of California? Everybody has a story, and Blue Shield's story started here in California in 1939 by a group of men and women, all physicians, who felt that every California had a right to have access to high quality healthcare at a sustainable, affordable price. And so that mission is what drives us today. We are a non-for-profit plan, we're headquartered in Oakland. We have 4.7 million members, and over the last 3 years, or the past 3 years, we've invested over $120 million to our Blue Shield of California Foundation, through our Blue Shield of California Foundation. So for those of you that are not familiar, there is a Blue Shield of California Foundation that has two main goals. Number one, to achieve health equity, and then also to eliminate domestic violence. So if you haven't had an opportunity to, receive a grant or look to see if your organization might be a grantee, I'd encourage you to go ahead and visit the Blue Shield of California Foundation, and then I'll send the link to that website. So I want to say thank you to Brian and Marisol. You've given me extra minutes. I was going to talk about the American Rescue Plan Act and the Inflation Reduction Act extension, and how that is so important to maintaining critical support for our middle income families. So what I'll do is I'll just skip over these slides since it's been covered already. But I do want to talk about how is it that we can find the right coverage for our families. So at Blue Shield of California, we offer a plan and in every zip code in all of our 58 counties in California. There are two ways that individuals and families can secure coverage. And then, this is really important because this is where you can help your clients decide what is the best option for them. So there's the off exchange and then the on exchange. So for the on exchange, I may not necessarily focus too much time here since many of you are subject matter experts in this area, but I do want to focus on the off exchange. So, there's a variety of issues why folks may not necessarily apply through Covered California. Maybe it's because they don't qualify. Maybe sometimes we do find stubborn folks out there that do not want to apply through Covered California. So at Blue Shield of California, there are the same plans on exchange for folks that may not necessarily qualify or look to purchase a plan through Covered California. So those are called off exchange. We have them available for those ages 0 to 64. And then the only documentation that you will need is proof of California residency. At Blue Shield, we will not be asking for a social security number, immigration documentations, income information, or federal tax information. So this is really important to have as you are navigating access to care and trying to identify what plan option fits best for your consumers. Just wanted to make sure that you are aware that at Blue Shield of California, we do offer off-exchange plans for those individuals. Similarly, we do also have our Medicare plans, our Medi-Cal plans, and our small group plans. Currently, Medi-Cal is only available in 2 counties in California, which is Los Angeles and San Diego. And so, with Medicare, I'm not going to necessarily focus in that area as we had a subject matter expert go over that information, which was really great. However, if somebody is looking for a webinar or a seminar, just to learn a little bit more about what plans or what benefits are available through the Blue Shield of California Medicare plans, we do ask you to visit our website or even go on Facebook for some of the Medicare seminars happening soon. As far as rates, Marisol addressed some of the numbers there. And one of the things that we have seen, and Covered California has also shared, is that after more than 2 years of lower than normal utilization rates, plans are seeing medical trends return to the pre-pandemic level. So as Marisol mentioned, at Covered California, enrollees will see an average preliminary rate change of 6%. For our Blue Shield plans, consumers will see approximately 5% change for our HMO and a 9% for our PPO. And why is this important? So I wanted to bring to your attention that price is king in anything that we do, whether it's we're going to purchase groceries, we're going to purchase a car, or we're gonna, assess whether or not we want to stay in that same health plan. So at Blue Shield of California, I just wanted to note here that in Region 14, which is Kern County, our price position for our PPO is that we are one of the most lowest priced plans in that region for our PPO on the silver medal tier. Equally, on the gold medal tier, Blue Shield of California is priced as the most price competitive in Kern County for our PPO option. And finally, on the bronze medal tier, Blue Shield of California is positioned number 1 as the most price competitive price option on the bronze medal tier. And this information is really important as you are navigating, you're having those conversations with with members and thinking, do I want to stay? Do I want to change? What is the provider network? What is the hospital? What are the benefits associated? So this is something that I just wanted to bring to your attention as we are helping our families and individuals navigate access to care. The next couple of slides will talk about our plan options and the benefits associated to a Blue Shield of California health plan. So the first plan option that we have available through Covered California and Off Exchange is our HMO, which is known as our Trio HMO. And this plan is designed to give members an affordable way to access high quality doctors. So it's the health plan, the hospital, and the medical group all working together to ensure that all aspects of care are more connected and efficient. And why is this important? Because we want to make sure that we keep premiums as low as possible and that we also have better patient outcomes. So the Trio plan includes the Shield Concierge, which is an integrated customer service model. And this is a really cool model because it brings all the different areas of Blue Shield under one roof. Members will have access to a team of customer service representatives, which inclusive of registered nurses, health coaches, pharmacy technicians, social workers, and more. And all of them are working together to make sure that there's better health outcomes for the member. The customer service specialists at Shield Concierge have access to shirt for providers and assigned PCPs. They can assist with complex claims and pharmacy issues, benefit questions, and much, much more. This team is available with extended hours, 7 a.m. to 7 p.m., Monday through Friday, and on the weekends, which is on Saturday from 8 a.m. to 5 p.m. This is a service area for our HMO plans. Currently, we are only offering our HMO plan in 28 counties. Some of those counties are a full county, which means that every zip code in that county is covered. And in some of those areas, it's only a partial coverage. I'll send definitely a link so that you'll find out a little bit more about what providers are available specifically in Kern County. We are expanding our footprint in 2023, which for the addition of 19 additional zip codes in Monterey County. And that's going to include all of our providers in the Aspire health system. For our PPO option, we are available in all of our 58 counties in California. It's with a high quality network of providers and hospital. These are some of the logos of some of the providers that we offer. We have more than 320 hospitals and more than 52,000 doctors. And this is a really, popular plan because it gives members the flexibility and choice to seek care wherever they are located, as long as that provider is within the PPO network. I like to call it the PPO corral, just to ensure that they are receiving the competitive rates. But this is the large choice of doctors, specialists, and hospitals that is offered in our PPO plan. And so another feature of our Blue Shield's PPO and HMO plan is our Blue Card coverage for emergency and urgent care needed. And this is for when members are out of state or out of the country. Members have access to providers for covered services, again, outside of California, or for urgent and emergency care only. We are proud to say that this is a very robust network. Over 90% of our providers in the United States belong to the Blue Card National Network. More than 200 countries worldwide belong to the Blue Card program. And the cool part about this is that when members are using Blue Card providers, they get to take advantage of our pre-negotiated rates. Sorry, we had some animation there. So our Wevolution is another of our features available with our HMO and our PPO plans. This is our online wellness solution. This takes an easy, social, and fun approach to wellness. There are no added costs to members. We're proud to say that this is the largest aggregation of health applications and programs in the industry. They've all been vetted by Blue Shield with proven results. They are categorized into 4 different programs. The member is able to select the application customized for their own individual goals. So if they're trying to develop a better better sleep habits or smoking cessation, deal with any disease prevention or diabetes, heart disease, or any other condition-specific situation, they'll be able to choose any of those applications. And in 2022, Wevolution definitely added a couple of other mental health support applications. So we've added Headspace, which offers guided meditations, sleepcasts, and the cool thing about Headspace is that they're available in 5 languages: Spanish, English, Portuguese, French, and German. We've also added Ginger, which provides on-demand confidential mental health care through coaching and self-guided activities. So again, these are all free. They don't have to pay any membership for these applications. They all come associated with the PPO and HMO plan benefits. Maternity Maven, this is another benefit that we added beginning this year in 2022. It's a digital and virtual product that is complement to in-person care. It offers programming and telehealth for the members and the partner during pregnancy, postpartum, and returning to work, or if the member experienced a pregnancy loss. There is access to on-demand virtual appointments. They'll have their own care advocate who can navigate access to care and understanding their plan benefits. And then there's a variety of educational resources, all virtual, with really cool articles and community forums. Again, this other benefit comes at no extra cost for the member. Then there's also California has a partnership with Trivity Health called Fitness Your Way. It's an exercise members and their dependents can exercise when and where it's convenient for them. They get access to thousands of fitness centers nationwide, starting at $25 a month. There's access to gyms near their home and work. The cool thing is that there's no contract commitments. There's flexibility to select a gym that's right for you. And then their dependents, as long as they're 18 years and older, are eligible to participate in Fitness Your Way benefit. The Blue Shield of California membership also offers a wide range of discount programs that can help members save money and take better care of themselves. For example, members can receive 25% off acupuncture, chiropractor, and therapeutic services through the American Specialty Health Providers. We encourage all of our members to visit our Blue Shield of California website /Be Well so that they can find and identify those member discounts that benefits them and their dependents. The next couple of slides, I just also want to talk about our dental, vision, and life standalone programs. So this chart here will help the member decide whether they're interested in a standalone dental HMO or PPO plan. Our dental HMO plan provider network includes more than 25,000 providers. The PPO is a little bit more extensive with more than 50,000 providers here in California. Again, these are standalone plans. You don't have to purchase a medical plan to be able to purchase one of these dental plans. We are also available in Covered California, but with the caveat with Covered California is that members have to purchase a medical plan in order to be able to have access to a dental plan. The good news about our dental plans is that they include orthodontia and implants. This year, we're waiving dental periods as long as there's proof of 12 months credible coverage from a previous carrier, and that includes Medi-Cal. Effective 1/1/2023, the HMO option will have no waiting period for ortho services. Plans start for as little as $1,150 a month. And it's really easy to apply, to compare and shop and compare whether this is one of the plans that you're interested. You see the information here. They can scan our QR code, give us a call, email us, or visit us online. Similarly, for our vision plans, monthly premiums start at less than $7 a month. This is a snapshot of one of our most popular plans, which is known as a 15/25/120. And why is it known that way? It's because there's a $15 copay for eye exams every 12 months. There's a $25 copay every 12 months for materials. And there's a $120 allowance for contact lenses. We offer one of the largest vision providers in California with over 7,000 optometrists, opticians, and ophthalmologists. Some of our providers include Costco, Target, Sam's Club, Walmart, and LensCrafters. Again, and the plans start for as little as $7 a month. It's equally as easy to get a quote and apply online. Information is here, and I'll send that, and you'll have access to this PowerPoint, so you'll have this information. Also, for individuals that are looking to purchase life insurance, Blue Shield of California has this benefit available, and rates are based on age, gender, and nicotine use. And as I mentioned, it's pretty easy to get a quote for applying off exchange, and also to get a quote for dental, vision, and life. You'll have access to this information here. My understanding is that's easier than the CalHERS application. So this can be definitely helpful for clients seeking an individual and family plan that do not necessarily meet Covered California's income or immigration eligibility guidelines. And as we're approaching conclusion of the presentation, I want to emphasize the community support and resources that Blue Shield offers to our community partners. We want to emphasize that our provider tool is available to the public. You do not have to be a member to find out if the provider is within the network. This access is available to learn and understand for our HMO and our PPO network. If you're looking for a participating physician, you can pan it depending on the plan type, the specialty, our location. And interestingly and really cool is that you can download the own directory to make sure that a provider that you're looking for is within the network. You can continue as a guest. It's going to ask you to identify the plan type, the plan year, the sub-plan. In this particular example here, we're thinking of 2021, our individual and family plan, which includes Covered California. A sub-plan we have identified as a Silver 70. The network is pretty expansive. So, you'll be able to, like I said, identify the provider network for consumers that are thinking of changing their health plan and want to identify whether a hospital or their specialist or their medical doctor is within that plan option. And then the other thing that I wanted to emphasize is that our Health Reimagined initiative created this free public data tool. And it's meant to be used by community groups and individuals that want to create opportunities for action. You'll type in a zip code and it'll give you information as far as demographics, social determinants of health. And this is really great data because, numbers always tell a story. So if you're trying to apply for a grant, or if you're trying to develop an outreach plan and you're trying to target a particular zip code and you want to know exactly what is happening in that geographic area, I encourage you to use our neighborhood health dashboard. Again, it's free, and you'll have access to the hyperlink so that you can check it out and consider if this is something that you want to complement with your initiatives and programs. Our statewide community outreach team was formed since inception of the implementation of the Affordable Care Act, and we have a group of dedicated staff that is meant to support our community partners and providers with a variety of outreach materials, support their community events, offer training such as these, and also to help and navigate access to care for our IFP members. We've developed an escalated enroller hotline. Our number is here, as you can see. We encourage you to stay connected with Blue Shield of California via a variety of different social platforms, whether it's Facebook, Instagram, Twitter, and we're also available on LinkedIn. And this is an opportunity for you to stay connected and informed in terms of initiatives, programs, policies, and changes.
Amelia, sorry to cut you.
That is pretty much it.
Oh,
the only thing that I just wanted to emphasize is that for those of you that are working with communities in having access to care, is that you help raise awareness about these benefits available and to them, that you share this information with your staff, and most importantly, that you encourage members to always check to be sure that providers in the Blue Shield network before seeking services. And if you have any ideas or you encourage any challenges or notice any trends, that you email us directly. And so with that, I just want to say thank you so much for the opportunity to be here this morning. I want to thank you for the important work that you do and for your dedication to Covered California members and their applicants. We look forward to working with you and the remainder of this year in 2023 to make sure that all Californians have access to the quality health care that they deserve. And I'll stop sharing. I'll turn it back to you, Rodrigo.
Thank you, Amelia. I know that's a lot of very useful information. Thank you so much for being here today and presenting that. We do have a knowledge check for the previous presentation, and so before you forget, we wanted to give you the opportunity to kind of refresh your memory a little bit and think back to Marisol's presentation. Besides the regular qualifying life events for Covered California's special enrollment period, name one additional way that an individual can enroll in Covered California outside of the open enrollment period. First correct answer. And there's multiple answers, but we'll accept the first a first correct answer. I believe there's 3 different options. Seeing anything in the chat? Maybe we'll leave that to the end with the raffles. All right, so that way we'll continue with our presentations. We do have HealthNet up next, so we want to open the microphone up to Angela. Angela, who's here from HealthNet to present, and then we also have Kaiser from Francisco Mercado standing by as well. So, Angela.
Okay, great. Thank you so much. Can I get access to share my screen, please?
Yes.
There you go.
Okay.
Thank you. Hi, everyone. As Rodrigo mentioned, my name is Angela. I am with the community engagement team at HealthNet that focuses on the Covered California plans. So really quickly today, I'm just going to give a really high level update on some of the things happening at HealthNet. Our vision really is to transform the community one person at a time in all the little different ways that we can, either through our health equity initiatives or through supporting CBOs like you and the work that you do. So it looks like a long list I'm going to go through, but really it's going to be quick. So next year for 2023, HealthNet is consolidating all of its plans under one regulator, the MCH, which is the Department of Managed Healthcare, instead of splitting all the plans up into 2, filing with the CDI, which is the California Department of Insurance, and DMCH. So all our plans will be under one regulator. All current plan members will stay with their plans through the end of the year. New members can still enroll till December 1st. And then when the new year comes, everybody will be automatically either transferred to a different plan or would have already chosen the new plan. So in Kern County, the Covered California plan that's currently offered is the HSP. So we're discontinuing that next year and replacing it with an HMO plan. So that's only going to affect 7,000 members, and which also includes other counties besides Kern. So the folks currently on HSP in Kern will be migrated to HMO. So the plan is called Am Better from HealthNet. So we had rebranded our Covered California plans last year. I'm not sure if you're aware or if you've seen our new logo and our new color, raspberry red. So that's the reason why you've seen maybe the different logo and the different colors. We did a rebranding, excuse me. So if for some reason you're doing an application, a paper application with HealthNet, you're going to see the new branding as well on the top. And then in Kern, we're only offering our HMO product. So it's not very complicated. It's going to be pretty straightforward. And currently, when I checked earlier this week, what Kern has, at least through our networks, is we've got over 630 providers and 6 hospitals that are contracted. So next year, the HMO product will be offered in all metal level tiers for people living in Kern. And then kind of Rodrigo had mentioned, that we'll talk about some of the things that sets health plans apart. And the added benefits really are where they will set everybody apart. HealthNet is offering a plan called My Health Pays. So members can earn rewards doing healthy activities, getting their annual exams, etc. So they can collect points and earn up to $500 each year to pay utilities, pay for childcare, for transportation, or shop at the My Health Rewards merchandise website to buy things that help them stay healthy and keep healthy. So again, it's limited to $500 a year, and we're not marketing this to them until after they've become members, because we don't want this to be the only incentive for them to sign up for a health plan. And then other options that we have for our members for the two different plans are we have the telehealth options, and then also some other mental health services options. So really these additional benefits are not to replace their PCPs, but to provide additional access points that members can receive services either at the privacy of their own home or at a local provider or over the phone. So we have the Nurse 24/7 hotline where members can access a licensed nurse any time of the night. Let's say your child gets sick in the middle of the night and you're not sure what to do, if you should go urgent care or the emergency room. You can just pick up the phone, call the nurse, and then she'll triage, or he will triage the call and give you advice from there and see if it's something you can wait till the morning, or it's something you need to be that can wait later on, and you can make an appointment with your PCP. And then also for our PPO plans, we have our members have access to the Minute Clinic, so they can be anywhere in the nation where a CVS Medi Clinic is available. They can walk in, see a licensed provider, get prescription filled, and get whatever issue it is taken care of that same visit. And members can also share that visit, the information of that visit, with their PCPs for follow-up as well. And then, the Minute Clinics can also do some vaccinations and then also screenings for chronic diseases. We also have My Strength, which is a online mental health tool for members. They can access it in the privacy of their own space to learn about different things they might be going through, how to deal with certain situations, etc. And then also we have a new program called Share Care. It's a great online tool for folks to manage chronic illnesses, to meet certain health goals and milestones. And then for with our PPO product, we also have Babylon, which is telehealth. A member can access a licensed provider through the phone or other devices, and also get their prescription sent to the local pharmacy and get that filled. So again, it's not to replace their PCPs, but just to provide an additional access point for services, during off hours, or for some reason they aren't able to make an appointment right away with their PCPs. And then lastly, I guess this is the last section of my presentation. I just wanted to share some enroller support services tools for you. I'll be transitioning out of HealthNet first week of October. So I'm really sad to be leaving this group, and I just really appreciate all the work that you guys have done on the grassroots level, advocating for your patients, your clients, and just helping folks get insured and educated about how to get insurance, how to stay healthy, and connecting them to services. So our team is going to be reduced to one person. So we've created some online support tools for you to be able to access some of the things that you might not be able to get right away. So if you need HealthNet collateral materials, you can order them through the link here. And then again, this presentation will be shared with you after the meeting. And then if you have a request related to events, you need a sponsorship, you need somebody to table from HealthNet, you have a gala you want sponsorship for, etc., or you just want promotional items, feel free to send a request through the link below as well. And then also we have a customer contact center that you can connect with also, as well as a dedicated enroller mailbox, email box that you can email any issue that you need us to escalate to. So it's enrollersolutions@healthnet.com. So if you're having difficulty in resolving a member issue, feel free to email that box with the member name, ID, date of birth, their contact number, preferred language, and then also a short description of what's going on and what you need help resolving. And then the response time is between 1 to 5 business days. And then lastly, if you want more details about what I had just kind of flown over, we will have our annual enroller summit next week on Thursday, the 29th from 1 p.m. to 2 p.m. So we'll go into depth about everything that I've talked to. And then there's also additional information that I didn't provide today that will be provided at the summit. So one of the great things that's going to happen at the end of the summit is that there's a $250 Target gift card giveaway. So if you stay till the end of the event, we're going to have a grand prize drawing, and you can register through the link or through the QR code that is provided there. So that's it. Thank you.
Well, thank you, Angela. Sorry to see you go. You know, you're a great resource as well for this network and for our program especially. So sad to see you go. But thank you for being here today and giving us an update. We're running a little short, very short on time, and I hope that you'll stick around for Kaiser Permanente's update from Francisco Mercado. He's joining us here, and Argelia also posted a note about our end of meeting raffles. So just hopefully you'll be able to stick around for that. All right. So, and I want to just thank you for being here this morning with us. So, Francisco, I'm going to hand the mic over to you.
All right, Rodrigo and Argelia, thank you very much for allowing us to come and talk to you guys today. Can you guys hear me okay?
Yes.
Yes.
All right, perfect. All right, give me a second, please. All right, so I'll keep it brief, just so that you know, I'm going to be focusing more on the resources available to our members in the Kern County area with Kaiser Permanente, and more than importantly, with any of the providers that are here, Blue Shield, HealthNet. We're here as an option more for the people looking for insurance, and I just really do encourage people to go ahead and take advantage of their insurance, because a lot of people don't use it. So I want to go ahead and just start off by just talking about Kaiser Permanente and how we have our integrated care model, which really means that every member has an electronic medical record stored in our system, which allows them to get the care that they need at that moment. They'll be able to get information pulled up based on their electronic medical record, so they can go to any facility to get the care they need with that information. In terms of Kaiser Permanente, we do encourage you, once you become a member, to join our website, kp.org, which is kaiserpermanente.org. This just opens up a world of resources for all our members, which allows them to go ahead and have video appointments with their doctors, phone appointments as well. They have access to a 24-hour, 7-day-a-week advice care nurse line as well. They can email their doctors with non-urgent questions 24 to 48 hours when they're going to get a response. They can schedule or cancel their appointments as well. And then also they can check their health records and pay their bills. So a lot of people will get results on any lab works they might do earlier in the day, and they'll get it later on in the day. So like I said, it's just very important. And we do encourage all our members to join kp.org as soon as they become members. In terms of the Kern County service area, we do have access for our members out there as well. We have medical centers that are affiliated with us. We have one that's out there, and that's the Adventist Health Bakersfield. We've got 9 medical office buildings as well. We got 2 specialty facilities, and then we've got a mobile health vehicle that visits Delano, Taft, and Wasco, on a weekly basis. And then we have urgent care through the Stockdale medical offices, which are available from 9 a.m. to 9 p.m., 7 days a week. The special facilities that I was talking about, we have behavioral health services on California Avenue, where they help with addiction medicine, psychiatry, and social services. And then we also have our Vision Essentials at the Marketplace on Ming Avenue. Call and schedule an appointment to shop or order your eyewear. There's a number on the screen, the 661-664-3300. Also, extra access to care. We have clinics inside the Target store on Rosedale Highway. Now, this is not an urgent care or emergency department, but it's minor care where they can help you out with flu shots, wellness exams. We've got school physicals for your kids, hearing and vision tests as well. Again, care for minor illnesses or injuries. So those are available, Monday through Friday, 9 a.m. to 7 p.m. as well. Saturday and Sunday from 11 to 4 p.m. and they're closed during the lunch hour. And then Monday through Friday, it's 1:30 to 2:30. That's their lunch hour. So again, you can access non-urgent care through these Target Minute Clinics. Then another thing I want to talk to you is the care away from home. Many questions are raised when we're attending events such as this or a health fair, and people come up to us and they always wonder if something happens when they're traveling internationally. Well, as I mentioned earlier, yes, everybody's covered for urgent care and emergency purposes anywhere in the world. If you're here in the States traveling and something should happen to you and you're in a state where there's no Kaiser Permanente facility, you have access to the Minute Clinics. It was mentioned earlier today. So inside the Minute Clinics, you can go ahead and get the attention you need. Same copay you have with Kaiser, the same copay you're gonna have at the CVS Minute Clinics as well. And then also you have access to Concentra urgent care centers whenever you're traveling nationwide. Again, if you spend any money up front, you'll get reimbursed when you come back home based on your plan. And lastly, the most recent addition to our care away from home is that you have access to Cigna's PPO network whenever you're traveling nationwide. This just started as of August 1st. So this is the latest and greatest. Okay, so again, we're trying to give you as much care as possible wherever there's no Kaiser facilities available in other states. And then below, you're going to see the 24-hour, 7-day away home travel line. As got the number there on the screen. Keep that number as well, because if something should happen to you when you're traveling, again, in a state where there's no Kaiser, call the number and ask to see where the nearest facility is that you could get care. Or you can visit our website, kp.org/travel to get more information on this. So on care while you're traveling. Lastly, this is the page that I always talk to people that people don't know they have. These are all the added, I call them bells and whistles, but these are resources that are available to them. And I'll just briefly touch upon it. ClassPass offers you over 4,000 workout videos, whether it's yoga, Pilates. You're able to go ahead and download those anytime you want. This is a free option for all our adult members at Kaiser Permanente. You got access to self-care apps such as the Calm and My Strength. Calm is a meditation app. Out there, if you go directly through the website of Calm, you're going to pay $70 a year. As a Kaiser Permanente adult member, you get this at no cost. Really great app. A lot of our members really do love it. And then the final one on the left-hand side, wellness coaching by phone. Again, if you need help with stress, if you want to eat healthier, you want to become more active, or even stop smoking, that can help you out with this resource. Again, free to all our adult members. And you're going to be talking to a wellness coach by phone, and they'll be helping you out, work through whatever challenges you have to create those great habits or good habits to get to your goals. And then we have reduced rates. Again, when you go to our website, kp.org, through the health and wellness tabs, it just opens up so many resources for you. So take advantage of that as well. And then also at the very end, we have online healthy lifestyle programs available to you, such as videos, podcasts, recipes, and much more. Visit those websites to get more information. So I just want to kind of just touch base with you. I know we're short on time, so I want to just go briefly through it. I don't want to hold you guys up anymore, but this brings us to the end of our presentation. Once again, thank you for allowing us that time to talk to you. I just wish we had a bit more time because I know we're pressed for time, but just wanted to get in a couple of words on the resources you have. Thank you very much for everything. Have a great day.
Thank you, Francisco. Thank you for being here today and providing that information to us. I hope that you'll be able to join us more often. And I think it's very important that Kaiser.
Definitely.
Also,
is that an invite? Is that an invite?
Yes, it is. It is.
Okay, now I'm family then. All right.
All right, great. Glad to have you. I think that concludes our meeting this morning. We do have another knowledge check. Name all the covered California health plans offered in Kern County. Now there's a few of them, so you must name all of them, and please remember to put them all in one comment. Partial answers are not accepted.
And Rodrigo,
yes,
as we're waiting for the answer in the Zoom chat, I will go ahead and share the poll for today's session.
Okay, great.
And it's just a quick 4-question survey that we'd always like our participants to engage in. And it just honestly just gives us a review of today's meeting. So we would really appreciate that.
Give us great feedback and helps us plan for the next meeting.
I see that we're getting some answers in the chat,
See that?
but all of them only have 3. And remember, there's a total of 4.
There is one with 4. And that's
Which one is it?
Miriam Asayari.
Medium.
She is the second one.
Oh, yes.
Okay, so she did say HealthNet, Kaiser, Blue Shield, and Anthem Blue Cross. That is correct.
Good
So
answer,
that's
Lisa. I
medium.
missed that. Medium, you're our winner.
Thank you.
And now we'll go to the raffles. Is that correct?
Yes.
Okay.
So let me,
And thank you all for staying with us till the end. I really appreciate you sticking around.
okay, let me just share my screen. These are for just a thank you for sticking around all the way to the end. I know we are 6 minutes over our allotted time frame. So let's see who wins first off the $10 Walmart gift card. Good luck. Christina Martinez. She's still connected with us. Yes, I see her connected. Congratulations. We have removed her and we will now be raffling off the 2 movie tickets for the Maya Cinemas. So I will be sending this through the mail to the person that wins. Congratulations, Christina Pruitt. Is she connected with us? Oh, I see her. Okay. All right. For all those winners for today, I will be sending those through email before today ends. And then I'll reach out to you, Christina, to see if I could get a mailing address for you. Okay. Once again, thank you so much for connecting and staying with us until the very end.
Thank you very much. Sorry to keep you all this late. So we'll see you next time. We'll send out an invitation once we get closer to a date that we finalize for our next meeting. Thank you all for joining us. Bye.